Hi there. Thanks for attending this virtual town hall. This is being put on by DiabetesWise. My name is Corey Hood. I'm a psychologist and professor at Stanford University. We make up the DiabetesWise team, and we're really excited about today's panel discussion. Also want to introduce Monica Lanning and Sierra Nelms, who are part of the DiabetesWise team, and you'll hear from them as we go along. Our team here at Stanford created DiabetesWise.org to be a free, unbranded resource for people with diabetes to learn about diabetes devices and technologies and what ways they could potentially benefit from their use. So our team certainly has a bias toward using devices, and we think that there can be a lot of benefit for people. But we believe the person should have access to devices and that they should have the choice to choose the devices that are best for them, which is why we're excited about this panel discussion today, which represents a lot of different groups here that make devices for people with diabetes. This town hall series and our whole DiabetesWise program is supported by the Helmsley Charitable Trust. The reason that we specifically focused on devices in the COVID era and why we're doing these sessions on using devices at this time is because we've heard from a number of people in the diabetes community that they worry about starting devices right now. They worry about some interruptions in use. And so we want to talk with the panelists today about all of that. If you have questions as we go along, drop those into the chat. You can put it to everybody so that way everybody can see it and everybody can have the discussion. And assuming that there's time near the end, we'll make sure we get to those questions and answers. So I want to dive right in today. I'm going to introduce Kyle Rose. Kyle is he hosted and moderated our session last week, but if you didn't attend, Kyle is, I think, first and foremost an advocate for people with diabetes. He's had a number of different roles across industry, nonprofits, and currently is the vice president on the board of directors at the International Diabetes Federation. And we're really excited to have Kyle as part of our team. He brings a really valuable perspective. And so I'm going to turn it over to Kyle now and have him introduce the panelists. Thanks for being here, Kyle.
Thank you. Yeah, I'm really looking forward to today's discussion, and I'd actually like to jump right in and begin introducing our esteemed panel. So I'm not sure who's going to be in which corner of the screen, so I'll refrain from saying on your top left and top right because I understand that can vary depending on your layout. But Dr. Trang Lai, so maybe you can raise your hand as I introduce you, is the Senior Vice President and Medical Director at Insulet Corporation. She leads the Omnipod Horizon Automated Glucose Clinical Program, which glucose control clinical program, which we'll probably hear more about throughout the course of the discussion. She is, her specialty is in pediatric endocrinology. She was previously at Stanford, and so knows of some of our DiabetesWise team and activities from her time there, as well as a fellow of the Royal Australasian College of Physicians. So thank you so much for being here, Dr. Lai, and thank you to Insulet. Moving right along, Dr. Robert Vigurski is the Chief Medical Officer for the Diabetes Group at Medtronic and a Professor of Medicine at the Uniformed Services University of the Health Sciences. Amongst many other accolades, he established the Diabetes Institute at Walter Reed, has been involved in the industry for some time with over 250 scholarly papers and abstracts focusing on the use of technology to improve outcomes of patients with diabetes. Thank you very much for being here, and thank you to Medtronic. Next, we have Dr. Steph Habib. And Dr. Habib is the Senior Director of Behavioral Sciences at Tandem Diabetes Care, where she oversees human factors and behavioral research. She has been involved in med tech and healthcare for 20 years, and also has faculty appointments at Columbia, Stanford, and Victoria University in Melbourne. So we welcome you, and thanks to Tandem for you being here. And the final panelist is Janice McLeod, and Janice has been leading the clinical advocacy at Companion Medical, with real focus on partnering with professional organizations and diabetes and tech thought leaders to establish smart insulin pens as a standard care for of care for injection therapy, and I think represents a really important group on MDI and pen infusion therapy. And I think you represent them alone today. So thank you very much for being here, and very much looking forward to continuing this discussion. I would just like to make the following acknowledgement, kind of along the lines of what we had mentioned last week. Is that, we'd already began kind of discussing the topic of access during our CGM town hall last week. And we find ourselves in an environment with COVID-19 where existing inequities, particularly for non-white communities in the US, are being put into the spotlight. And I think that very much includes healthcare. And while most commonly discussed in terms of access in healthcare, we talk about the product of insulin, understandably so, insulin affordability and so forth. We also believe that the medical device category that administers this drug or monitors it is very relevant in terms of access, and is very much in our mission to educate and empower and increase discussion about these devices. And thus, thank you for representing the organizations you do today and manufacturing these devices. I'd like to jump right in now into our first question. And I'll direct this one to you, Steph, for starters, but would like to hear discussion afterwards from other members of the panel. And that is, here we are in COVID-19 environment, and following maybe perhaps what I just said in terms of access, how have you seen it, both personally and across your company, change the way that you operate? What's been most difficult in adjusting to this new normal?
Sure, thanks for the question. Hi, everybody. Very happy to be with this group today. Well, I would say quickly two things. Historically, I report to an office every day. I go to our offices, which are headquartered here in San Diego, California. That's where I'm talking to from. We have offices here in San Diego and Boise, and our businesses are continuing to fully operate, but much of our teams, both in San Diego and Boise, are working remotely now. And I think that's true for a lot of people around the world. In California, healthcare operations are deemed critical by the state, so we can continue to provide products and services to customers all around the world, and our manufacturing warehouse facilities continue to operate as normal with the necessary safety accommodations in place, obviously. They haven't missed a beat, and we're so grateful for their efforts. So it's business as normal. I miss the human element of how we go about doing our jobs every day, certainly. But then the second thing is, historically, people new to Tandem are required to participate in an in-person educational training session with one of our clinical diabetes specialists. And with the start of COVID, the Food and Drug Administration allowed Tandem to remotely train people who want to be remotely trained. So that's been a big pivot for us, and we did that seamlessly. To give an example, in 2019, I think we completed approximately 1,500 remote training sessions over the course of the entire year. And just in the last 2 months, we've completed more than 3 times that number of remote trainings. And our satisfaction scores are just as high, if not higher, than from when we were measuring from just in-person training. Our remote training satisfaction scores are in the high 90s. I think the last score I saw was 98%. So we continue to give patients the choice as to whether or not they would like to be trained with one of our specialists in person or remotely. But we're finding a lot of people are very comfortable with remote training, and they seem to be doing very well.
Thanks very much, Steph. And right along the lines of that question, I think that is a nice segue into another set of questions. Bob, if I could ask you to comment. I know that Medtronic has been doing some work in this area as well. I would love to hear your thoughts.
Yeah, so thanks for inviting me and Medtronic to be here. We've been, I think we'll probably find a lot of commonality in how this COVID-19 pandemic has affected our companies, our patients, our providers, And the one thing that's happened at Medtronic is we literally pivoted almost overnight to all virtual training. And we have done, since March, over 11,000 trainings on our pump systems and CGM. And I just yesterday, we had a publication that documented the outcomes of this kind of training. It's in Diabetes Technology and Therapeutics. And so we went back and we looked at the efficacy and the processes involved in training virtually in a 33-day period from March to April, and compared that to in a similar period back in January to February, which was face-to-face. And just like Steph said, we found a lot of satisfaction from the patients. The Net Promoter Scores, which is a metric to indicate satisfaction, were sky high. We used Zoom to do this. We got 98% of people like the Zoom application. We got our processes and after prescription and shipping and starting training actually was faster in the COVID era. And most importantly, the outcomes in terms of time in range, auto mode use, time below range were virtually the same as face-to-face. So I think this is, it's important for a number of reasons. I think it's a proof of principle. I think going forward that we really want to think about, are we going to continue to do this? And like all training, we want to be sure that the outcomes are at least equivalent, and maybe they may be better. And there's lots of reasons for that. And as things get back to normal, it'll be interesting for us and all of us to see how this actually plays out. But from our experience, it's been really gratifying to see how our trainers and how the patients and the healthcare providers have really come together and made this work. From the standpoint of our workforce, the Medtronic workforce, like all our companies, safeguarding our employees is really number one. And virtually everyone is, no pun intended, virtually everyone is virtually working from home, except in our manufacturing facilities. And they continue. We have a manufacturing facility in Northridge in California, and we have one in Puerto Rico, and those have not missed a beat, and they're continuing to produce all our products. So there have been no product shortages as a result, and we really are very thankful to those essential workers to get into the factories and keep our patients safe. So that may be a little bit longer explanation than you wanted, but that's what's going on in Medtronic.
That's helpful, and I think we'll get into that topic of perceived or potential shortages, because I think that's really important for our users here in just a moment. So thank you for having already addressed that. I was so excited about the discussion that I jumped in before we did our first poll question, which is intended to learn a little bit more about our audience. And Mike, if I could ask you please to put it up there, I'll be happy to read out the question. Here it is. So we'll just put pause on that discussion for a moment while we ask this question. What is your primary connection to diabetes? Now I'll let the users have a few moments to answer that. Okay. Just a few more seconds. All right, let's wrap that up, please. Thank you. So as I understand it, everyone should be able to see these results, but just to announce them, we have about 34% with type 1 diabetes themselves, and the second largest category is other. So that'll be interesting as we learn more in terms of feedback from the users who that means. But we do have representation across the board from carers, some healthcare professionals as well, and some people with type 2 diabetes, of course, as well. So thank you for answering that. And actually, maybe let's go right into that second poll question, because that's the one that is discussing device usage. I think could be helpful for our panel to see what diabetes devices are you currently using. I feel like we need to have some version of the Jeopardy music here for our DiabetesWise panels in the future. We'll be happy to take any suggestions from the audience. All right, let's give that just a few more seconds.
I love all the Omnipod shout outs from the chat.
Yeah, and I think you're doing a better job, Trang, than me of following all the chat. I see a lot of activity there, and I'm fortunate enough to have colleagues who are going to bring to light some of those questions and comments. Okay, so the answers are in here. We have 48%, so nearly half, using CGM or Flash. Wow, that's big. We have more than 40% using insulin pumps. And then the next would be a traditional blood glucose meter. A decent amount of folks already on AID systems. I'm sure we'll get into that discussion later. And then still a fair amount of people not using diabetes devices. And of course, certainly one of our goals here is to try to understand why and see where there could be good fits to find devices that fit people's therapy. So let's jump right back into discussion. Thank you for your patience, panelists, and learning a little bit more about our audience. We had just mentioned that there is some concern from the community, and I think I've heard this firsthand, is during COVID-19, should I be worried about supply interruption? And I think there's two important questions here, and I'm going to break those up into two. So let's start with that one. Bob, you already mentioned that's not something to be worried about at Medtronic. Anyone else like to jump in and comment about how supplies are going? Because I think this is really an important one for the community to hear.
I can jump in. Hi, everyone. I'm Trang. So, in terms of the COVID crisis, we've been dealing with the issue from January because we have manufacturing in both China and in the United States. And so we've worked, and what's really interesting is in China, our employees actually live on site. And so when COVID crisis started being more prevalent, we actually had to isolate all of our employees for 2 weeks when they had gone home and come back to the facility, and really take a lot of precautions to make sure that production was, was uninterrupted. And so we're, really pleased to say that we were able to maintain production throughout this time in both China and the US, and maintain pod production without skipping a beat for our podders. And we're really proud of that, and still continue every day to monitor very closely the health and well-being of our employees to make sure that each of our patients and everyone in our podder family gets the pods. So from our perspective, really no interruption in supply at all for Omnipod.
Okay, yeah, and I'll add into that as well from the companion medical perspective that we've been able to continue production uninterrupted in our San Diego facilities now in 2 locations, recognized, as Dr. Vigursky discussed, as an essential business. So we've had no supply interruptions, and everything has continued to go smoothly from that standpoint. So, but as other than the production staff, of course, most of our staff is working remotely, and the biggest adjustment, of course, would be for our field-based sales and clinical teams that are so used to being out there with and working very collaboratively and in a consultative way with our healthcare providers that are then interacting with the people with diabetes that are using our products in Penn. So, really cognizant of the fact that people with diabetes are being, it's just disproportionately affecting that population. And so our healthcare providers, are bearing a pretty big burden, wanting to make sure that their patients have all the prescriptions they need, all the supplies they need, and also proactively working to make sure that they're able to achieve and maintain as good of diabetes management as they can to mitigate risk. So really wanting to be there for our healthcare providers. So we have worked to develop virtual programming and support mechanisms, including support for our healthcare providers directly, but also prior to COVID and continuing through COVID, have offered virtual onboarding sessions for people getting started with InPen that they can access at no charge. So that's been some ways that we've been able to continue to support both people with diabetes and the people that are taking care of the people with diabetes.
Such an important point, Janice. Thank you. I mean, as we know, during this time, there's been a huge impact on employment and therefore insurance. And so this is probably one of the most important questions across the board for the panel is, do you have programs in place that were either existing beforehand or ones that you've put in place now during this difficult time for people who may be in need? And how would people go about trying to find out if they're eligible and qualify, et cetera?
I can answer that. I can take a first stab. So we do have financial assistance programs at Insulet. We had them pre-COVID, and we actually expanded our program for our US participants, podders, and also for our Canadian podders as well. So expansion of that. And in terms of, how you qualify, the best way to get that information is really to call our customer care line, because they can really walk through the individual needs and assessment there.
Wonderful.
Yeah, I can jump in. So Medtronic has always had some flexibility in their payment system, but as of the COVID era, we launched something called Medtronic Assurance. So that is a 3-month free supplies for patients who use our sensors and pumps, and that is contingent, of course, on those who've lost their jobs and have no income. And after the 3 months, now that this is going on, we're going to take this case by case basis, because some people are going back to work, some aren't. And but we do guarantee 3 months for those who have lost their jobs, and we look forward, of course, all look forward to the time when this kind of assistance isn't needed. But we know that, and we really don't want people to stop their therapy because of this pandemic. I just was on a call this morning. Trang was on that call too, with a forum run by ATTD about the COVID-19 pandemic. And I showed a survey from the Kaiser Family Foundation, in which about half the people were not getting the medical care. This is not just diabetes, medical care that they, and the office visits that they had previously expected to get. And 11% of them, their health was actually getting worse. So I would expect that the subset of people who have diabetes would probably be maybe even higher if they're not being followed by their healthcare provider, and we hope not. But so the pandemic has had a lot of consequences, not just in technology users, but in non-technology users.
Yeah, and I'll just add, prior to COVID and then throughout COVID, Companion Medical has been very committed to making sure that people with diabetes can access InPen at an affordable cost. It is a prescription only device, so it's covered as a pharmacy benefit. And then Companion Medical has a special copay assistance program. So InPen costs no more than $35 annual copay. And I do want to emphasize the word annual because that's a little bit different since the pen is a durable insulin pen that lasts for a year. So it's an annual $35 copay for commercially insured patients. It's covered by the majority of plans. Very similar to what Trang was describing, really encourage anybody who's interested in using InPen, regardless of what your insurance is, or what your coverage is to, if you're interested in that, the opportunity is to visit the Companion Medicals. There's a link, Get InPen, that we've provided, in fact, to the DiabetesWise team, which will later be made available to all the viewers. And that's the same thing, get in contact with the care team that then can look at each individual situation and determine the best path for that person and provide a no obligation verification of their insurance benefits so they'll know what to expect and can make a decision accordingly.
I think I'm really encouraged to hear all of us talk about how committed we are to access to the best of our ability. I think whether it was pre-COVID or now with COVID, it sounds like all of us are set up to do the best we possibly can to make it affordable. Tandem, certainly the same as the other companies mentioned, we have easy information available on our website, or you can call the phone number to find out how we can work with you to get the lowest possible out-of-cost option if a Tandem system is what you're interested in. Tandem is a durable medical device, so different than, say, Companion InPen, where it goes on a yearly basis. For the Tandem system, it's for 4 years. So that's a little bit different, but the way Tandem has set it up to maximize access is, for anybody who's ever used a Tandem t:slim X2 pump, it's a software updatable insulin pump. And so we make those software updates available at no extra out-of-pocket cost for people who want to use that system. So as the latest and greatest advancements in the technology become available, you don't have to buy a new piece of hardware. You don't have to go through the whole rigmarole again of getting qualified and figure out how to pay. You can just go through a remote software update from the comfort of your home or wherever you are. And we have found that has made for some very happy customers.
I think that's really, it's not only reassuring, it's encouraging to hear that these programs exist. And I think that we'll certainly, as to your point, Janice, link to the relevant information that you all have provided us so that people can get that directly off of our websites. So thank you for spending some time on this important topic. I wanted to move on to the topic of telehealth. And we've already touched upon this a little bit, but I think that one of the considerations that's very relevant to COVID-19 is we're hearing that a lot of people are reluctant to go into their doctors. Now, of course, we're encouraging people to go into their doctors as they need to, because that's also, we know, a point of concern. But if people are able to do, whether it's an onboarding, as was described earlier, or just communicate in general with their care team via these devices, I think that could be very appealing and not necessarily something that people know about. So I know there was a lot of interest in this question, and Janice, maybe I can start with you and hear Companion Medical's approach as it relates to communicating with care teams and patients.
Yeah, this is such an important one that I think during this time, it's just illustrated how now more than ever, it's so important that we recognize the ability to access data remotely and share that data with care teams remotely. So important. And now that we can do that and continue to make informed decisions with our patients, even when we're not able to be in person. So what's really exciting, what's really been kind of fun to just see happen in front of us is just realizing the power of finally having dose data available for the first time for people on injection therapy. We've not had that before. And to finally actually be able to have that, and to be able to have that paired with other related data is so incredibly powerful. And what that allows us to do, in whether the visit's remote or in person, is it allows to have a very informed conversation with that patient. So think about if you're a clinician. I worked with diabetes patients for many, many years in clinical practice, and I always felt like I had to almost interrogate my patients, ask them the 20 questions, just trying to get to the basic data. But if instead now the patient can easily send a report remotely right through their app, very easy to do. That integrated report is sent by fax, email, airdrop, whatever, print, send, however the patient wants to do it. That gives that clinician a chance to use that data report, hopefully with screen share right in that telehealth visit, and look at that data together and figure out where things are working, where things need improvement. And what I love about it is it takes away those 20 questions. Instead of having to ask all those questions, now we can let the patient tell us their story, and we weave the story around the data, and the data just becomes a fact. It's not judgmental, it's just there. And now we can really solve some problems and help people make some really good progress. So it's been exciting to bring that to injection therapy finally, as we been offering that for years with pump therapy. My pump partners here have done an awesome job with great tools and really wonderful reports. And now we're bringing similar solutions to injection therapy.
Trang, can I pass this discussion point on to you? I know you had some interesting examples on behalf of Insulet. Thank you, Janice.
Yeah, I think similar to what a lot of the other panelists have said, we've moved to virtual care and really seen a lot of, a lot of satisfaction from our new podders. I would say that actually just a couple of weeks ago, we did a new software release for our PDM, which is our remote controller device. And with that newer software, the data can go directly via Wi-Fi from the PDM to our Insulet cloud and talk directly to Gluco cloud. And so that data will go directly to Gluco, and so the healthcare provider can log in directly into their Gluco account and see that insulin information. So that's an update that just came out, excuse me, recently, only for US customers. But that capability is something that we're really proud of, and something that we hope will really enhance the ability to make the telehealth as efficient as possible for our healthcare providers. And I'd say, the other thing is if people are worried about seeing their healthcare provider, it's very safe, as long as people are wearing masks and washing their hands to go in and see your healthcare provider. One of the interesting things about all of this pandemic is, I've gone from being the medical director of a company to sort of now also being kind of the resident COVID expert for like 1,600 employees as well. And so we've really had to think about how do we practice safely to make sure that our employees, actually probably about a third of our field staff actually have diabetes themselves. And, how do we make sure that they're as safe as possible in interacting and training with our patients if they have to do a face-to-face training. And so I think it is, I would assure people who are worried about that it is safe as long as you're washing your hands and wearing a mask. It really reduces that infectivity.
Thank you.
I can throw in and tell the Tandem update as well, related to telehealth. So just a few weeks ago, we released a new mobile app, which for somebody who's wearing the t:slim X2 insulin pump, that mobile app Bluetooth connects to your pump, and it's a secondary display of what's happening. For those of you familiar with the Tandem system, being able to see what's going on through a secondary display mobile app provides a lot more visibility into your therapy, because there's just a lot more real estate, digital real estate, if you will, on a smartphone interface than on our pump interface, because our pump is small and sleek. Similar to what you heard from Omnipod, we enable for people who use that mobile app, the data wirelessly uploads to the Tandem system into our cloud. So if you're somebody who's wearing a t:slim pump and you choose to use the mobile app, all of the data from your pump is available to your healthcare provider through the t:connect web application. And so being able to enable healthcare providers to see what's happening and be available through the phone or whatever, to help coach patients, to help keep patients safe, to answer questions, is obviously more important now than ever before. I think at the same time, like it was already mentioned, there's a lot about advancing this type of medical technology that still requires some face-to-face interaction. So I think it sounds like everybody's doing the right and responsible thing for staying safe, wearing protective gear, meeting if needed. The diabetes community has always been one of the most special in terms of helping each other and being available to each other. So whether we do that more and more virtually or not, it's going to keep continuing. So that's really nice to hear.
Thank you, Steph. Go ahead, Bob. Looked like you were just turning your mic on.
Yeah, so I just wanted to reiterate some of the points that were already made, and sort of give a future-looking perspective. So the ability to get the data and have the physician look at it without having the patient come into the office is really a game changer. And of course, Medtronic has our CareLink reports, and these reports are really wonderful for the healthcare providers for a number of reasons. First of all, they allow us to assess what's going on in terms of glycemic control. So we call that the A of the ABCs, and assessing that data and having a very robust but clear data display is really very, very helpful for the healthcare provider and for the patient with diabetes, so that they can understand it as well. But in addition to the glycemic control, and I know Trang agrees with this, the behavioral aspects of what's going on can be understood in part by looking at the data and looking at some of the other features of our CareLink system. How often there's a change of sensor, how often there's a change in infusion set. Are you actually doing correction boluses? Are you bolusing before, after, or during a meal? I mean, all these things are very actionable, and the C is for the ABCs is for our providers, our care providers, to take that data and use that actionable information to help achieve better overall control, and of course reducing the burden, because as these systems get better, the reliance on the healthcare provider to actually micromanage the settings of closed loop systems is going to be reduced significantly, and it's all going to be run by these algorithms. Our mantra at Medtronic is to trust the algorithm, because it's smarter than I am and most physicians, and it can do it a hell of a lot faster. So so these are some of the things that are available by having remote connectivity, having a cloud-based artificial intelligence and pattern recognition software that all allow the patient to get a better result and for the healthcare providers to do a better job even without the patient coming into the clinic.
Thank you. I think there's a lot to chew on there, and I would actually like to pause and do another poll question for our audience while we do. Monica, could you throw our next poll question up, please? So we hear that there are still a number of concerns, and understandably so when we're thinking about attaching a device, but maybe if I could just read the question, what is your biggest concern with regards to wearing a diabetes device? And so there's a long list there: wearability, comfort, ease of use, discretion, cost and insurance coverage, avoiding lows. The healthcare professional doesn't think it's a good fit. We had a discussion about that in last week's session. I don't have any concerns, or other. And while we're waiting for responses there, I'll take the opportunity to talk about DiabetesWise's wisdom videos, which I really encourage you to take a look at the website. We have testimonials from a number of people who have tried out devices and are talking about their experiences, and many of whom talk about initial concerns that somehow they didn't necessarily find to be such a concern, or how they addressed it. And I think that testimonial and experience is something that's really treasured in the wisdom. All right, with that, let's conclude the poll, please. And we still have cost and insurance coverage coming up as kind of the largest answer in terms of numbers. And I think we've already began to address a little bit of that in terms of access. Hopefully some of these programs can help. Wearability and comfort, ease of use, avoiding lows, and a decent amount of people that don't have any concerns. So I think we're making progress as a space to address some of these concerns, but we perhaps have a lot of work to do. And what I was really interested in some of your comments there, Bob, was when I hear about the intelligence of the new systems in terms of recognizing and troubleshooting some of these diabetes daily management tasks. So working with my healthcare professional, speaking myself as a person living with diabetes, or via the software itself, trying to learn how to adapt. And one example that's very personal to me is there were certain infusion sets during my life as a pumper that were working better than others, and trying to understand, certainly based with a coupled CGM system, which of those were absorbing better was a big learning lesson to me, in addition to all the impact of food. All right, so I'd like to go back to or actually tail on to that question.
So Kyle, can I just mention something, because you mentioned infusion sets, and we're in the final stages of concluding a trial of a 7-day infusion set, and so I think we don't have we haven't finished the trial. It hasn't gone to the FDA yet, but if this is in fact successful, I think it will really make a big difference for our patients who are looking for real estate all the time and having to change every 2 or 3 days versus 7 days is really going to make a big difference in terms of, again, the burden of diabetes.
That's very exciting to hear, and I think it's a great segue into maybe one of the topics we can address as we get towards the top of the hour, and that's new products and partnerships. And I think that there's a lot of excitement about new products that have been discussed. I know that some of you are limited, certainly, in terms of what you can share. Thank you for sharing that, Bob. But in general, will, as it relates to COVID, there be any potential delays, do you think? Whether it's Omnipod Horizon or Medtronic 780? I know there were some questions on the chat about that. Is there anything you're able to share about kind of as we move forward in terms of next generations, whether it's your own product or partnerships? And I'll leave that as an open question.
I can go first. So we have lots of exciting things coming up, and one project is Omnipod 5 powered by Horizon, which is our automated insulin delivery system. And that, as Jim in the chat noted, is in clinical trials right now. We have 235 people using it at various stages, and we're excited to be wrapping up that study in the next few weeks for submission to FDA later this year, and then coming out first half of next year. And that's super exciting for us because we've been working on it for 4 years. It's our first integrated pump with Dexcom, and we'll also be coming out with phone control as well. So you'll be able to download an app from your Android phone as a first offering, and then iOS will come later as well. So that's super exciting. And then we also announced that we're working with Libre as well. So coming to market with Horizon or Omnipod 5 powered by Horizon with the Libre sensor, and that's with their Libre 2 sensor. So that's real-time CGM. And then we have Omnipod with Tidepool, so Tidepool Loop, so where the DIY loop algorithm, where Tidepool is working on commercializing that as an app that you can download, and that it will be compatible with various pumps and sensors. So we were, one of the first pump companies to announce a partnership with them, and so that's super exciting. And there's data that is coming out that has been collected to help support that work and submission. So lots of really exciting collaborations with other industry partners, and really great to see the potential for Omnipod to reach a lot more patients globally.
Yeah, and I'll just jump in as well, kind of going back a little bit to that last poll question. And then I'll jump into the future as well here a little bit. But it's of interest that, for a variety of reasons, the majority of patients on insulin therapy have chosen to stay with injection therapy. And so being able to, there's a variety of reasons for that. It can be cost, it can be convenience, it can be perceived sorts of things that may or may not be as true once the person actually gets into the experience of using the device, that, as was mentioned earlier. But I think it's important to realize that we're finally able to offer similar dosing support for people who choose not to want to wear something. They just don't want to. It's a psychological barrier, whatever it might be. And so finally being able to address that need. And also, I think when we talk about, people being in a financially constrained environment and things, also being able to say, look, we can do similar dosing support. It's not quite the same, it's similar. With a lower cost, familiar, durable insulin pen paired to a smart diabetes management app, that really gives some opportunities and choices to people to say, maybe right now, maybe because of financial constraints, maybe because of my personal preferences, I just want to be able to have some options. And I think what's really exciting too is where we're going to be able to go with even injection therapy in terms of being able to offer more and more services, which we're looking to do in our roadmap coming up in 2020. And of course, it'll go beyond that as well. But thinking about, automated weight-based setup and ongoing titration of the various insulin types, as well as thinking about data-driven education, similar to what Dr. Vygotsky was saying. We can notice things in the data. We can notice these patients are never priming. That's a real problem for at least certain patient populations. And so we can deliver education to that specific person because we notice their behavior, or they're never correcting, they're missing correction opportunities, those kinds of things. So it's really exciting where this can go and where we know it will be headed. I'll also say in terms of sort of some new things is that we recently did receive an expanded indication for the for all ages, which is kind of exciting because we already were in the pediatric market, but all ages 7, or excuse me, lower than 7 have to be with a caretaker. That would be the parent in most cases. So that makes sense. But then another new addition that we think is going to really be helpful to expand the utility of this product into a much, much broader population, and that's with type 2 diabetes on injection therapy, offering, in addition to the carb counting dose calculator mode, the meal estimation mode. And that means adjusting the dose based on the relative meal size as well as fixed dose. So we're really looking forward to exploring what it's going to take to take that into a broader market, the primary care and so forth, and also automating what more we can automate to really take that burden off of the healthcare provider as well as that person living with diabetes. So it's exciting to see the AID folks are also jumping into the meal estimation. So it's going to be just, we have a lot to learn, a lot of things to think about and bring together. So I look forward to working with, you know, all of the partners here on this panel to start fleshing out what some of this means.
Thanks, Janice. And I think it's important to absolutely validate your comment regarding numbers. I mean, the data is clear. The vast majority of insulin users in the diabetes population are using injection therapy. And thus, I think the excitement that a device like yours could connect them to the power of data and structure some of the patterns, identification, and help as far as managing their therapy. So thank you for that additional comment.
Yeah, and I should have mentioned, you know, also integrating with CGM and other Bluetooth connected glucose meters, and hoping to very soon be able to offer that in real time, currently with the 3-hour delay. So that will make it, that will be another big game changer for this population of patients as well.
I know there's some additional interest across the panel I can see, but I also am watching the time go by very quickly. And I would like to reserve at least our last 5 minutes for some Q&A. So if we could, Monica, please turn off the recording and